Did you know that by age 80, more than half of all Americans either have a cataract or have had cataract surgery? If you're noticing changes in your vision, you're not alone. Let's explore the subtle signs that might be more than just normal aging. So, what exactly are cataracts? Well, imagine your eye's lens getting cloudy, like a window that's slowly fogging up. This cloudiness affects how light passes through your eye, making your vision less clear. But here's the thing. Cataracts can sneak up on you, and you might not even realize it's happening. In this video, I'm going to uncover those sneaky signs of cataracts and talk about when it might be time to consider treatment. Understanding these changes isn't just about seeing better, it's about maintaining your quality of life and keeping your eyes healthy for years to come. Ready to learn more? Let's dive in and clear things up. So talking about the sneaky symptoms of cataracts, you might not even realize they're creeping up on you, but understanding these signs can make a world of a difference, especially in your vision. First up, the most common symptom, blurred vision. Imagine looking through a window that's slowly getting dirtier over time. That's what cataracts can do to your eyesight. At first, it might be subtle. Maybe you're squinting a bit more to read street signs or having trouble making out details in your favorite TV show. But as cataracts progress, it's like that window is getting foggier and foggier. Now here's something interesting about cataracts. They don't just affect how sharp your vision is, they can actually change how you see colors. Have you ever noticed that the world seems a bit less vibrant lately? It's not your imagination. Cataracts can make colors appear faded or even washed out. Some people even describe seeing a yellowish or brownish tint over everything they see. It's as if someone's placed a filter over your eyes, muting the bright blues and vivid greens you used to enjoy. But wait, there's more. Cataract can also make you more sensitive to glare. Bright lights may start to bother you more than usual, especially at night. You might notice halos or starbursts around light sources like headlights or street lamps. This can make nighttime driving particularly challenging. If you found yourself feeling less confident behind the wheel after dark, cataracts could be the culprit. And speaking of driving, let's talk about how cataracts can affect your vision in low light condition. As the sun goes down, you might notice that your vision becomes even more blurry or hazy. Tasks that were once easy, like reading a menu in a dimly lit restaurant, or even recognizing faces across a room, suddenly become more difficult to do. Now here's a quirky twist in the cataract story, something called second sight. It sounds like a superpower, doesn't it? Well, it's not quite that exciting, but it is interesting. Some people with cataracts experience a temporary improvement in their near vision. And during second sight, people actually get a little bit of improvement where their prescription changes and they can actually see things up close better without glasses. But unfortunately, and this is where you shouldn't get too excited, this effect is usually short-lived and doesn't mean that your cataracts are going to go away. Another sneaky symptom of cataracts is a change in your contrast sensitivity. This means it becomes harder to distinguish between similar colors or shades. You might have trouble seeing the edge of a white plate on a light-colored tablecloth, or you may struggle to make out steps on a staircase. This can be particularly problematic when it comes to safety, making it harder to navigate uneven surfaces or spot potential hazards. And really, one of the most trickiest things about cataracts is really how gradually they develop. Your brain is incredibly adaptable and will try to compensate for the changes in your vision. This means you might not even realize how much your eyesight has deteriorated until it starts to significantly impact your daily life. So, why is all this information important? Well, recognizing these symptoms early can make a big difference. It empowers you to take control of your eye health and seek help when you need it. So whether it's for you or a loved one, being aware of these signs and symptoms means you can take action sooner rather than later. And now I would like to talk about how cataracts can shake up your daily life in ways that you might not expect. I've covered blurry vision and color changes, but cataracts have a way of rippling through your everyday activities that goes beyond just fuzzy eyesight. First up, I'm going to talk about glasses. If you found yourself making more frequent trips to get your glasses checked, cataracts might be the culprit. As cataracts progress, you might notice your eyeglass prescription changing more often than usual. It's like your eyes are playing a constant game of catch-up, trying to compensate for the cloudy lens. But here's the thing. No matter how many times you update, your prescription, it might feel like your vision is never quite right. Now think about your favorite activities: reading a good book, catching up on your favorite TV show, or recognizing faces across a room. These simple pleasures can become real challenges when cataracts start to interfere. Imagine trying to read the morning newspaper, but the words seem to blur out. Or you're watching a movie, but struggling to make out the details on the screen. It's not just frustrating, it can start to affect your enjoyment of life's little moments. But it's not just about leisure activities. Cataracts can throw a wrench in your day-to-day tasks too. Have you ever found yourself squinting at your computer screen at work, or having trouble reading important documents? These vision changes can impact your productivity and even your confidence in your abilities. But the effects of cataracts don't stop at the physical. They can take an emotional toll on you as well. As your vision changes, you might find yourself withdrawing from activities you once loved. Maybe you're not as keen to drive at night anymore, so you start skipping evening outings with your friends. Or perhaps you're hesitant to try new hobbies that require good eyesight. This gradual withdrawal can lead to feelings of isolation and loss of independence. It's not uncommon for people with progressing cataracts to experience frustration, anxiety, or even depression as they grapple with these changes. You might find yourself relying more on others for help with tasks you used to do easily on your own. This shift in independence can be tough to accept, and it's okay to feel a bit overwhelmed by it all. But here is the good news. Understanding these ripple effects is another powerful tool. It helps you recognize when cataracts are starting to impact your quality of life in a very meaningful way. This awareness is crucial because it can guide your decision about when to seek professional help or consider treatment. And I want you to remember that cataract treatment isn't only about improving your vision. It's about reclaiming your independence, rediscovering your favorite activities, and feeling confident in your daily life again. By recognizing how cataracts are affecting you just beyond your blurry vision, you're taking the first step towards clearer sight and a brighter outlook. Now that I've explored how cataracts can impact your daily life, I want to talk about what you can do when they start to interfere too much. You might be wondering, is it time to consider surgery? Well, you're not alone in asking that question. First, I want to address something very important. Cataract surgery isn't as daunting as it may sound. In fact, it's one of the most common and safest surgical procedures out there. Over 90% of patients report improved vision after cataract surgery. That's pretty impressive. But how do you know when it's time to take the first step? Well, here's the thing. There's no strict timeline for when you should get cataract surgery. It's not like there's a magical age or a specific level of vision loss that automatically means it's time to head to the operating room. Instead, the decision is based on how the cataracts are affecting your daily life. So ask yourself, are you having trouble doing the things you love? Maybe reading has become a struggle, or you're not as confident driving anymore, especially at night. Perhaps you've given up on some of your favorite hobbies because your vision just isn't what it used to be. These are the kinds of signs that might indicate it's time to have a serious conversation with your eye doctor about surgery. Now let's talk about what actually happens during cataract surgery. This is going to be more of a brief overview. If you want a more in-depth discussion, check out the video here that goes throughout that. The basic idea is pretty simple. The cloudy lens in your eye is replaced with an artificial one. It's like swapping out a foggy window for a clear one. The procedure itself usually takes about 15 to 20 minutes. That's less time than it takes to watch your favorite sitcom. During the surgery, you'll be awake but sedated. Your eye will be numb, and you might see some light and movement, but that's about it. The surgeon will make a tiny incision in your eye, remove the cloudy lens, and replace it with a clear artificial one. This new lens is called an intraocular lens, or IOL for short. Now you might be wondering about recovery time. The good news is that most people start to notice a significant improvement in their vision within the first few days after surgery. Of course, everyone's recovery is a bit different, but many patients are pleasantly surprised by how quickly they're able to get back to their normal activities. But now I want to address the elephant in the room. What about the risk? It's natural to have some concerns about any surgical procedure. And while cataract surgery is very safe, there are some potential risks to be aware of. These include infection, bleeding, inflammation, and loss of vision. You could also get something called a posterior capsular opacification PCO, which can cause cloudy vision again. But don't let these possibilities scare you off. Your eye doctor will go over all the potential risks and benefits with you in detail. And also, here's something to keep in mind. You don't need to rush into surgery. As research shows, most people don't need to rush into cataract surgery. Waiting to have surgery usually won't harm your eyes or make surgery more difficult later on. So if you're not quite ready, that's okay. You have time to think it over and make the decision that's right for you. And here's an interesting fact about cataracts, is that they can develop in one eye or both eyes, but they don't spread from one eye to the other. Each eye is on its own journey, so to speak. And after surgery, many patients experience a return of clarity and vibrancy in their vision. It's like the world gets a new coat of paint. Colors are brighter, details are sharper, and everything just looks clearer. So now, wrapping up our chat about cataracts, remember those sneaky symptoms we talked about? Blurry vision, color changes, glare sensitivity. These are the key signs to watch for. But it's not just about spotting the signs. It's about taking action. Regular eye exams are crucial, especially if you're over the age of 60. They're your best defense against cataracts as well as other eye issues. And here's a quick little tip. Do you want to keep your eyes healthy? Here's how. Wear those UV blocking sunglasses when you're out and about. And don't forget to eat your fruits and veggies. They're packed with the eye-loving nutrients. By understanding cataracts and taking care of your eyes, you're setting yourself up for clearer vision ahead. Whether it's through early detection or eventual treatment, there's a brighter, clearer world waiting for you. Your eyes do so much for you. Isn't it time to return the favor?